Hey guys, welcome back to another lecture of Dental Pathshala where we help you understand and learn dentistry better and easy way. And this is a continuation of the express revision course for pedodontics. And before we get started, make sure you subscribe to the channel and hit on the bell icon so that you don't miss any of our exciting videos. And if you are interested in watching more videos like this, you can check out in the playlist of our channel. Or if you are interested in reading the notes of this particular lecture, you can check out the link provided in the description box below, or you can check out our website www.xtooth.com. So guys, let's get started with the today's topic, which is traumatology in the pediatric dentistry. So in this particular video lecture, we will be talking about all the traumas which are related in pediatric dentistry, and we'll be talking about the Ellis classification and all the classification which are involved with the teeth and especially the pediatric. So let's get started with the most famous classification of the traumatic injuries, which is the Ellis and Davies classification, which was given in 1960s. So there are 9 classes of Ellis and Davies classification, guys. How you can remember it is the most easiest way you can remember is the class 1 starts from the E itself. So the class 1 is only the enamel. So there is only the fracture of the crown, wherein there is only fracture of enamel. There can be involvement of little or no dentine, but usually it is the fracture of the enamel. The class 2 Ellis classification is the enamel plus dentine. So there is going to be the fracture of the crown which involves the dentine as well. The class 3 is enamel plus dentine plus pulp. So this is enamel plus dentine plus pulp. That means it is the fracture of the crown which involves the dentine, and there can be involvement of the pulp as well. There is going to be involvement of the pulp. Now talking about the class 4 classification of the Davies classification, guys, you can remember it from non-vital. So in the type 4 classification of the Ellis classification is the tooth which has undergone the traumatic injury has become non-vital. So what do we mean by the term non-vital? That means the tooth is dead. It is not living anymore. So this tooth has become the non-vital. There can be involvement of the crown or there cannot be involvement of the crown. That means there can be loss of the crown. That is what I mean. So there can be a fracture of the crown. There cannot be fracture of the crown. Irrelevant of the crown fracture, the tooth is dead. It is non-vital in the class 4. Class 5 according to Ellis is, guys, when the child takes out the tooth in your dental clinic. That means the tooth is in the child's hand. That means there is total loss of the tooth. The tooth is extruded out from the socket, which we generally call the X articulation. That means the avulsion of the teeth. Guys, avulsion is a term which we give when there is complete avulsion of the tooth, complete displacement of the tooth out of its socket. So now that you see, this was a socket. Earlier there was a tooth in here like this. Now what happens during the injury, traumatic injury, there is complete loss of the tooth from its socket. So there is no tooth which is present anymore. So this situation is what do we call the avulsion, or we also call X articulation. So talking about the class 6 Ellis classification, so this is the root fracture. Root fracture. So Ellis class 6 is the fracture of the root with or without the loss of the crown structure. There can be loss of the crown, there cannot be loss of the crown, but definitely there is going to be the fracture of the root. Talking about the 7 Ellis classification is the displacement of the teeth. So guys, it is very easy, you can remember it. The first one is enamel, second one is enamel plus dentine, the third one is enamel plus dentine plus pulp, right? But after that it becomes trickier. So how can you remember it? Let's just write the 7th one. So it is the displacement of the tooth. So how can you remember it, guys? Take the first letter from each of these. So N-A-R-D, nard. You can remember it from the word nard. So that is from 4 to 7. This is how you can remember it. So we have the non-vital, then avulsion, then root fracture, then there is a displacement, and 9 is for baby. We know that baby comes out after the 9 month of pregnancy. So 9, guys, is always remember that it is the baby. That means the primary teeth. So we have got 8, then we have got 9. Ninth one is, we know that primary teeth. Primary teeth. So how you can remember it? 9 is from baby, you can remember. Right. So if there is any traumatic injury to the primary tooth, we call it, according to Ellis and Davies, guys, it is class 9 fracture. Either it is crown or root to the primary. In the primary teeth, you hardly get to see the root fracture. Most commonly, there is a crown fracture which is associated, and there is also avulsion of the teeth, but most commonly you see that there is a fracture of the crown. So that case, that particular traumatic injury to the primary teeth, either it is any of the class, but irrelevant of the fracture or the injury to the tooth, what kind of, either it is crown or root or displacement, according to Ellis and Davy, we categorize into the class 9 of the Ellis and Davy classification. So the 8th one which we are left is, guys, it is the fracture of the crown en masse. That means whole of the crown is fractured. So that is according to the Ellis classification. Now there is another classification which is nowadays most commonly asked as the WHO classification. First of all, we'll be dealing with lot of numericals or numbers in WHO classification. So we have, you have to write 8, 7 and 6. Now you have to put a dot in here, then you have to cut down the 6 into half, so that becomes 3. Then the classification start from 873.60. So again we'll be starting with, guys, with the enamel fracture, right? Then 873.61, we have got the fracture of the dentine. So that is enamel plus dentine fracture. Then, guys, there is 873.62. That becomes enamel plus dentine plus pulp. So this is up till now it is similar to the Ellis and Davies classification, but now this classification is going to be different. So 873.63, this is the point wherein the differences start. So we have got the root fracture, then there is a crown fracture, so which is very simple according to WHO. So that becomes 873.64. Now 5, if you remember, is out. 5, you remember avulsion. So you can remember it. 5 is when the tooth is out of the socket. So you can remember the word out. So 5 is out of WHO classification. There is no avulsion. So here in WHO, 8, it is not there. 5 is not there. So 873.66. Now 6 is, if you remember, the 6th one is the root fracture, but we have already included the root. So after root, what was there? It was the displacement of the tooth. So we have here, we have the concussion and luxation in the 6. Then we have 873.67. That makes it when the tooth is going inside the socket, then it is known as intrusion. When the tooth is coming out of the socket, then we call it the extrusion. So if there is displacement of teeth in the socket, in means in the socket, X means out of the socket. So that means, suppose, say this is the socket, the tooth which was earlier like this, now in case of intrusion, later on after the injury, the tooth becomes like this. So the tooth actually gets inside the socket in case of intrusion. But in case of extrusion, what do you see? After the extrusion injury, that means the tooth is displaced out of the socket. Say this was the socket, the tooth is displaced out of the socket. So usually in intrusion, what do you see? There is a fracture of the alveolar bone at the apex. So there is fracture of the bone. So fracture of the socket, this is what you see in case of intrusion. because the tooth is going inside. When it is going inside, say when this tooth is going inside the bone, it is going to fracture all that bone. So that was about 873.67. We are at 873.68 and up till 9. Here also we have up till 9, 873.69. So 68 is the avulsion now, which was the fifth one in Ellis and Davis, and 69 is the soft tissues injury. So the WHO classification has also included the soft tissue injuries. Now you will be like, ma'am, why this WHO classification? We already had the Ellis classification. So guys, WHO classification has got few plus points. One is that it is for both the dentition. So it is for primary as well as the deciduous dentition. For the primary and the permanent, the primary and deciduous are the same name. So both the primary and the permanent dentition. Then the WHO classification, guys, is not limited to the anterior teeth, unlike the Ellis classification. So it has got few plus points. Guys, you may find some disturbance today in the lecture, maybe because my mic isn't working. So I'm recording as it is. There is no mic today. So talking about the next classification, guys, which is the Anderson classification. Now, Anderson has described the injuries to the hard tissues and the pulp, same, but he has given the different terminologies for these. So it is same like WHO. It has got 873.60 starting from this. The 60 is the enamel fracture. Now the enamel fracture, he has given the term as the crown infarction. So that means that there is the fracture of the enamel of the tooth structure. Then he has given 873.61. So this is enamel plus dentine, guys. Now I want you to understand one thing, that if there is no involvement of the pulp, then this we call it uncomplicated, because we can easily restore it with a restorative material. So it is not complicated. We do not have to go for root canal treatment. So remember this, that when we do not have to go for root canal treatment, when there is no pulpal involvement, we call it the uncomplicated fracture. So when the fracture is confined only to the enamel and the dentine, but it is not involving the pulp, we call it the uncomplicated. And because we are talking about the crown, so this is uncomplicated crown fracture, right? Then we have 873.62. So 62 will be enamel plus dentine plus pulp. Now here there is involvement of the pulp, you can see. So this is known as the complicated. So it is the complicated crown fracture. Very easy, right? So when it is exposing the pulp. Then guys, this was about the crown fracture. Now there is crown root fracture. So when there is also a fracture of the root along with the crown, according to the Anderson, 873.63. And guys, if you remember, this is not 63, here it is 64. So guys, if you remember that in the WHO classification, 873.63 is the fracture of the root. See, you can have a look at here. 873.63 is the fracture of the root. Now you can see here, it is the fracture of the root. Now also we will be talking about the root crown fracture here. So 873.63 in the Anderson is again uncomplicated, but this time it is root crown fracture, or you can say crown root fracture. Not earlier it was only crown, but here crown and root both are involved, but it is still uncomplicated. That means there is fracture of enamel, involvement of dentine, as well as, guys, we have cementum in here. So C is the cementum. So we have crown, enamel, dentine and the cementum involvement. 873.64 guys is the when there is fracture of enamel plus dentine plus cementum plus pulp. So if there is involvement of pulp, what do we call, guys? We call it the complicated. So we have complicated crown root fracture, right? Because here there is involvement of cementum as well. That is why we are calling the crown root. Now, the last one is basically this. That is about the Anderson classification. Now, guys, we'll be talking about when there is injury to the PDL. So, in case if there is injury to the PDL, which is the supporting structures, then we have got the categories to it. That is, the first one is the concussion. Now, concussion is a term, guys, which we describe it when there is a injury to the tooth supporting structures. So I'm just going to write PDL, that is positive. That means the tooth supporting, let me write it here this time in the bracket, tooth supporting structures, but otherwise I'm not going to write for rest of the things. So tooth supporting structures. Then, guys, if there is loosening of the teeth, no, that is negative. If there is displacement, no, that is also, we don't see any displacement. So basically, when you take the back end of the mouth mirror and then you try to tap it on the tooth which is traumatized, the patient is going to say, ah, that means that is going to be reaction on the percussion. That means that there is going to be tender on percussion. The patient is going to get the pain on the percussion. That is the concussion. When there is tender on percussion, positive, right? So that is our concussion. So remember, concussion is tender on percussion, which is very easy. So it's like a rhyme. Concussion is tender on percussion, right? Next one we have is, let's take the different color. So next one we have is the subluxation, guys. Subluxation, you can remember it from loosening. So take this L word and then go for the term loosening. So what happens here? There is definitely going to be the tender on percussion, positive for this. So I'm just going to write PDL positive. That means injury to the tooth supporting structures. But there is going to be loosening. This time the tooth will be little mobile, but there is no displacement of the teeth. So do we see the displacement of the teeth? No, we don't see, which is the negative. So the next one here we have is the now luxation injuries, guys. So in the luxation, starting with the first one is intrusion. So intrusion is when the tooth is displaced into the socket. So that means, let's take the different color so that we understand the bone, right? So say suppose this is the socket. This is the socket, right? The tooth is normally like this, right? But what happens in case when there is a displacement of the tooth into the alveolar bone after the injury, which is what do we call the intrusion? So what happens? The tooth is usually gone inside the socket, guys, like this. So because of that, there is going to be the fracture of this bone, like this, fracture of the socket. So we see there is fracture of the socket, or there can be comminution. So basically in the intrusion, what we see is displacement of the teeth. Yes, definitely, which is into the socket. So displacement positive. Where tooth is getting displaced? Into the socket. So in the socket, so that we can easily remember and recall that in means in the socket, right? So this is about the intrusion. Then we have got the another type of injury is the extrusion, right? So guys, then we have got, say, extrusion. So guys, we have extrusion. Extrusion is displacement into this, out of the socket, into the, in means intrusion, x means out of the socket, right? X means out. So that is kind of a partial avulsion. It is not complete avulsion because the tooth is not completely out of the socket. It is just halfway out. So we can say partial avulsion. So if you look at It looks something like this. Say this is the tooth socket. Then if we see that the avulsion, partial avulsion, it is not complete avulsion, right? So like this. So this is out of the socket. We say out of the socket, but it is not complete out. When it is completely out of the socket, we call it the term avulsion. So extrusion is, yes, displacement is definitely positive for this, which is out of the socket. Then guys, we have the lateral luxation. So guys, lateral luxation is when the tooth is displaced laterally. So that means, say if this is the socket, this is the previous position of the tooth inside the socket. So what happens after injury? The tooth is displaced. So instead of that, the tooth is now, guys, like this. So it is displaced laterally. So displacement is there. Yes, displacement is there, which is laterally, right? Sometimes what do you see that also there is fracture of the socket. So we see that there is fracture of the socket in case of lateral luxation. Then guys, there is avulsion. Avulsion or X articulation, that means the tooth is completely out of socket. Complete displacement. That means when the person is taking the tooth in the hand and coming to your clinic. So it's a complete displacement of the tooth out of the socket. So here is an empty socket in case of X articulation or the avulsion. So where have you seen the fracture of the socket, guys? Fracture of the socket, alveolar socket, in two situations, right? One is the intrusion and another one is the lateral luxation. Then there are also injuries to the soft tissues. Let's see the injuries to the soft tissue. We have laceration. Laceration is basically, suppose you take a knife and then you stab it from a knife. So I'm just going to make a knife here. So if you stab someone from the knife, what kind of wound will be? It is going to be most probably deep. So there is either a deep, it depends on the injury, like it can be shallow or deep. But basically what do you see? You see that there is a tearing of the mucosa, right? So this is about the laceration. Then guys, we have the other soft tissue injury is the contusion. So contusion is, say if your sibling has like pushed you or hit hard from a rod. So if there is a steel rod and in a fight that somebody has like injured from some rod or something like that, that means there is no break in the, say let's make a rod, right? Standing rod, let's draw like this. So if somebody has hit hard on this, So there is a bruising which we see, right? Let me draw the violet area also. Okay, guys. We are supposed to draw from this. Okay. So there is darkening of that particular area. So we see that there is break in the epithelium. No. There is no break in the mucosa, right? No, it's not there. Then we usually see that there is a bruising. And this is from the blunt object. Blunt object. The third kind of injury, guys, we see is the abrasion. This is also soft tissue injury. So abrasion is scraping. Scraping, like say this is a pen or a pencil. This is the skin surface. Once you try to try to scrape it, there are like lines which you get, right? So these are the scraping wounds. Wounds from the scraping or rubbing, you can say, on the mucosa. There can be bleeding also. Bleeding can be there, depend on how much the injury is there. So there are superficial wounds which we see. So guys, let's finish the treatment of these traumatic injuries in the next part of the video lecture. I want to make it short because I'm not sure of the audio clarity because the mic is not working. So let's cover the treatment of the trauma or traumatic injuries in the next part of the video lecture. Hope you have enjoyed this video, and if you have enjoyed this video, give it a thumbs up. Also comment in the comment section below because this motivates me to put more videos for you guys and to make free notes. So till then, keep reading, keep learning, stay motivated, and you can also support us on Paytm as well as on PayPal to make more free videos like this. So guys, see you in the next video lecture.